Well, welcome to this lecture on the NUDAWNS non-prescription medication counseling format. So let's start with the word NUDAWNS, N-U-D-A-W-N-S. That's an acronym standing for basically the steps we want you to follow when counseling a patient on a non-prescription or over-the-counter medication that you have selected for them. So it is to help you remember the sequence and the topics to cover to provide them in an organized, straightforward way to provide that information to your patients. So let's start with what does each letter stand for. So NUDAWNS, and again spelled N-U, not N-E-W, so N-U for new. The first letter N stands for name. But by name, we mean both the name of the medication, its strength, as well as the dosage form. So all of that is included in describing the name of the product you are recommending. The second letter U stands for use. So in this case, you're going to re-emphasizing what this medication is to be used for, or why the patient should use this medication. The third letter is D, and that stands for dosage. In this case, this is looking at the product and instructing the patient on the dosage regimen. That is, how many should they take, how often, at what time. So going through and reading the instructions for dosing the product for the patient. The fourth letter is A, and in this case, A stands for administration. Now, there may not be a lot to talk about if, for example, you are recommending a tablet or a capsule that is simply swallowed by mouth, although you would clarify maybe to take it with a meal or to take it on an empty stomach. But oftentimes, over-the-counter medications require more complicated administration instructions for products such as eye drops or ear drops or topical creams, possibly suppositories. So there are many different dosage forms of over-the-counter medications where their administration is more complicated. So certainly that would fall under the A for the administration section. After the administration section, then comes W, and W stands for warnings. And this is looking at the box and showing them the warnings section, and then maybe highlighting one or two warnings that the patient should be aware about before taking this medication. The second to the last letter is N, and N stands for non-pharmacologic treatments. So in addition to using this medication, what are some other things that they can do to help treat their condition that don't require a medication? So these are the non-pharmacologic treatments. And the last letter in NUDAWNS is S. And S stands for seek, meaning when should the patient stop using the medication and seek further medical attention? When has the condition either worsened or not improved over a certain amount of time, such that they should at this point go ahead and speak to their healthcare provider? So those are what all the letters stand for. So to help you remember those topics, just remember NUDAWNS, N-U-D-A-W-N-S. Remembering NUDAWNS will help you remember the format and the topics and the order to cover the information when counseling a patient on a new over-the-counter or non-prescription medication. We'll start with the first letter, which is N, and N stands for name. But that's a little misleading because it isn't just saying the name. It is saying the name of the medication, as well as the strength, and also the dosage form. To complicate this further, there are some examples where there are two names. There is both the generic name and the brand name product. So I'll go through a couple of examples on this slide of how we would want you to indicate the name of the product you are recommending. Starting on the left, the first product shown would be described as Docusate 100 milligram soft gel capsules. The next product would be described as hydrocortisone 1% topical cream. Now, those were both generic drugs and therefore only had one name. The remaining two products have both the brand name and the name of the ingredients by their generic name. So examples for this would include ZQuil Ultra nighttime sleep aid, which contains doxylamine 25 milligram tablets. And then lastly, we have Visine allergy eye relief multifunction eye drops, which contain naphthalene 0.025% and phenyramine 0.3% ophthalmic solution. So as you can see, names can be complicated depending on whether or not you are dispensing a brand name product versus a generic name product. Some drugs have no strength, some have fairly straightforward strength, such as 100 milligrams. Others are expressed as concentrations. And then lastly, you must always include the dosage form, whether that's tablet, capsule, cream, suspension, ophthalmic solution, or any other type of dosage form that can be dispensed over the counter. The next topic to discuss with the patient would be the product's use. So U for the acronym. However, this is a little bit of an oversimplification because U or use stands for both the purpose as listed in the drug facts information on the product as well as the use. So purpose and use are both included under the U for use section of NUDAWNS. So I've got 4 different products here, and I will try to illustrate for you how you would transition from the name of the product into the use. So for the first product, after describing the name, and this product is Nizoral AD shampoo, which contains ketoconazole, as you can see, the transition would be, after describing the name, that the purpose of this shampoo is to be used as an anti-dandruff shampoo, meaning this shampoo helps control the flaking, scaling, and itching associated with dandruff. So it's essentially reading the purpose and leading into the use. The bottom left product was Compound W wart removing gel. So you would describe this gel is used to remove warts, and it removes the two types of warts. It removes both common and plantar types of warts. Okay, going to the right-hand side, there are some products where the use is a little more complicated, as you can see on the top right for the product for Tylenol extra strength tablets or acetaminophen 500 milligram tablets. It has a purpose but multiple uses. It is not expected that you would read all of the different uses, but make it patient specific. So again, if you have a patient who's coming in for needing a treatment for headache, for minor pain relief due to occasional headache, then how you would maybe transition after describing the name of this product would be, and this medication is used as both a pain reliever and a fever reducer. For you, it's been intended to use as to relieve the temporary pain associated with your headache. And then lastly, on the bottom right, we see that some uses are a little more complicated depending on the product. In this case, this is labeling for the over-the-counter product Prilosec OTC. So after describing the name and strength and dosage form for the patient, you would say that this medication is an acid reducer, and it's used to treat frequent heartburn, and by that I mean heartburn that occurs more than 2 days per week. Now, when we're treating this heartburn, understand this is not intended for the immediate relief of heartburn, because this medication can take anywhere from 1 to 4 days before it sees its full effect. So it's a medication intended to be used longer term for people who have frequent episodes of heartburn 2 or more times per week for week after week. So those are examples of how, after describing the name, you're then going to go to the drug facts section and use both the purpose of the medication and its use, and to describe that for the patient. So we've completed the N and the U. So the NU or new part of NUDAWNS we have discussed. We are now going to discuss the DAWNS, D-A-W-N-S. And I'm emphasizing here that the next 2 letters, D and A, are kind of related to each other in terms of the directions section of the drug facts labeling on a non-prescription medication. D stands for dosage and A stands for administration. Both of the information for those sections can be contained, at least in part, in the directions section. So on the package labeling, and you kind of see down here in my example for Flonase, in the directions section, it starts off with some information that would be important for using in discussing the administration section. And then below that, in the blue box, you can see that's where it actually gets to some of the dosage information. So directions section on drug facts contains information for both the dosage as well as the administration of the product. This is where things can get a little bit tricky for students because we want you to clarify this information and not group it all together. We want you to first discuss the dosage. Be very clear with the patient how many and how often and at what time they should use this product. So describe the dosage first. The D in NUDAWNS, the D stands for dosage. After discussing the dosage, then you will go into much more detail about the administration. So that information for both of these sections can come from the directions section, but we want you to start first by discussing just the dosage and then go into the how to administer. So let's start with the D section in NUDAWNS, D for dosage, and talk about that section specifically in more detail. So in dosage, we are really referring in general about how many to take at a time, how often during the day, and possibly when in terms of morning or evening or afternoon, things like that. So that's the kind of information we're trying to provide. As I mentioned, this information will come from the directions section, and again, we will often then ignore or not yet address any administration type information in this section and focus really on giving some clear information about the dosage. So to that end, let's look at some of the examples I show on this slide. On the left-hand side at the very top, these are some information that comes from Pat-a-Day ophthalmic solution or eye drops. And if we look at the directions on the back, we would tell the patient that in adults, the recommended dosage is to put 1 drop into the affected eye and to do that once daily. Pretty straightforward. But I also want you to realize in all of our examples that I'm going to show you here, almost all over-the-counter products also indicate a maximum to use per day. That is, a do not exceed using this number per day. So I would go on in this example for Pat-a-Day and say that it is important that you do not use more than 1 drop in each eye per day. So emphasize how often and when to take it, and also do not take more than or do not use more than this amount. Oftentimes that's included in many of the products. The second product on the list, so if we look on the far left in the middle, this one is from a Persagel acne cream to be applied. I chose this one as an example to show you how oftentimes the dosage and the administration sections are combined. Because if you read through this direction section in the blue box there, it really starts with a lot of counseling information, but then it gets into the how often to use it. So the second statement says to cover the affected area with a thin layer 1 to 3 times per day. Okay, so that would be the directions we would say first. So if I was counseling on that, so on this Persagel, if we look under the direction section here, it does state that you're going to want to cover the entire area and apply a thin layer of film to the affected area and do that anywhere from 1 to 3 times a day. Okay, you'll notice there isn't a do not use more than type of instructions here, but then you, after going through the directions or the dosage, you would then cover the rest of the information provided under administration. Okay, but let's keep going with other examples of directions because something I haven't emphasized yet, if we look on the far left at the very bottom, this is some directions from Alka-Seltzer tablets, and you're going to see here that age becomes very important when we are recommending a dosage for a patient. So in this case, for the example for the Alka-Seltzer, we can see that there is 1 dosing information for adults and children 12 years and older. But then under adults, we have a second one for adults 60 years and older. And then we can see that in children less than 12, the product should not be used without speaking to their healthcare provider. So age, and as you'll see in a minute here, weight sometimes are important considerations in determining the appropriate dosage for a patient. So in this example for the Alka-Seltzer, again on the far left on the bottom, we can see the only difference isn't how often they're going to use it per day, but the do not take more than is what is different. So if we were to have a 65-year-old patient, for example, we could say, now if you look here on the back under the directions, as far as dosage goes, it says for a patient who is 65 years of age that you would want to take 2 of these tablets every 4 hours. 2 tablets every 4 hours, but it would not be, it's very important for you to not exceed or do not take more than 4 tablets in a day. So that's where you would get the 4 tablets since the patient is over 60 years of age versus the 8 tablets if they were less than 60 years of age and above 12. So don't want to talk about this, but it's important to read the directions section carefully when you're trying to tell the patient the dosage and consider either their age in this example, or let's look in the middle here. For this package here is for acetaminophen or Tylenol suspension that you would use obviously for children, and the directions for in the part that relates to dosage, you can see there's a lot of administration stuff, but right above the table is where we would say, all right, you're going to want to give this medication a dose every 4 hours to your child as they need it while their symptoms are still occurring. And this, whether it's for pain or maybe more likely for fever, you would give and repeat this dose every 4 hours, but you do not want to give more than 5 doses in a day, or no more than 5 doses in a 24-hour period. Now, for your child, you told me that they weighed 50 pounds or that they were 7 years of age. Therefore, the recommended dosage for them would be 10 milliliters. All right? So that's the idea of using that table there and clarifying how much, in this case, based off of either the weight or the age, you would give them the volume of the acetaminophen to use, and then follow that up with the frequency being every 4 hours, and then finally with it being no more than 5 times per day in 24 hours. All right. And then the last one on the far right was for some Imodium AD for diarrhea. And again, just emphasizes that there are multiple ages here. In this case, we've got adults and children over 12. Then we have a different recommendation for 9 to 11 years of age, and you can also see the weight range there, and age 6 to 8, or the weight range of 48 to 59 pounds. And we can see that ages 2 to 5 should not be used without talking with their healthcare provider, and we do not use this medication in children under 2 years of age. So again, you don't have to read all of this information to your patient. You would only provide them the information that is specific for the patient, but this is why, as a part of your Scholar Mac and a part of your trying to gather information from your patient before making a recommendation, part of what you may need to know is either the age or the weight of the patient that will be using this medication, because the dosage will be dependent on that. And last point on here, dosage often involves how many, how often, and possibly at what time. So ending up with the Imodium, if we were doing it for a 30-year-old adult, we could say, if you see here on the back under the adult section, the instructions are to take 2 caplets and to take that after your first loose stool. Then you can take and continue to take 1 caplet after each subsequent loose stool, but you're not going to want to take more than 4 caplets in a 24-hour period. So, how many, how often, and a do not take more than are the basic instructions you provide under the D or the dosage section in the NUDAWNS. So after explaining the dosage, the next letter is A. A stands for administration. So after you tell them how often to take the medication, then you give them any instructions they may need about how to take the medication. Sometimes this is fairly straightforward and minimal. Other times it can involve a lot of information that the patient might need to be able to correctly use that medication. So again, if we look on the top left here, this is the directions section from a product called Gas X capsules. And after telling them the dosage, we would follow up with to be sure and take these capsules with water, and you're going to take them only as needed, but do so after your meals and at bedtime if you're experiencing the symptoms of having intestinal gas. So pretty straightforward, but here we're clarifying to take them with water after meals and at bedtime. We gave them specific times of day in terms of to administer this. All right. I don't think a lot of additional information is needed at that point for that product. However, if we were dispensing the product Miralax over the counter to be used for constipation or to be used as a laxative, this is a powder that has to be dissolved in a very certain way. So under the directions section here, you can see there is a lot of additional information on steps that the patient needs to use. So this is one where you would show them that information on the label and kind of talk through each of those steps. Fairly straightforward. Now on the top right, this is just an example with Breva, which is used for cold sores. So this is one where they do give a fair amount of additional information in terms of counseling that you would want to provide to the patient. And you'll see this is one where it's a little bit confusing. The last bullet point on the right-hand side of this image says use 5 times a day until healed. So sometimes the dosage section gets really hard to separate from the administration section for some of the labelings of the products. But here we can see to wash the hands and apply to the affected area of the lips or face and so forth in the instructions. Now, these are not always complete instructions. You have to use your own experience and knowledge about the product and the dosage form to ensure that the patient really does go through all of the steps that they need and understand that. Now, on the right-hand side in the middle, this is an example from Salon Pa's pain patches, where the directions on the back actually has a nice illustrations on how to actually administer the patch. So this is where you could use that information to help explain to the patient as well. And really my last example here is the fact that some products do not provide any real administration information beyond the basic dosage. So on the lower right, this is really the directions section from swimmer eardrops. And all it says is to apply 4 to 5 drops into the affected ear, which is the dosage for the product, and provides no additional administration. But this is where the pharmacist would absolutely need to make sure the patient knows how to administer an eardrop, and if they don't, you would have to go through all of the steps on how to do that. And unfortunately, not all of the labeling on the products provides that level of administration. So, for example, the test that we give for eye drops and eardrops requires the pharmacy student to know that information on how to administer those drops and to not rely on the labeling on the package to provide detailed administration instructions. The product will always have the expected required dosage information for dosing the product, but may or may not have very detailed or robust information for the patient on how to administer the product. This is where the pharmacist can greatly aid and assist the patient when counseling them on a new product, and especially if it's one that does have more difficult or more steps required in administering the product based off of the dosage form. All right, the next letter we are going to discuss is the W. So the W in NUDAWNS stands for warnings, and this information comes from the warnings section of the drug facts labeling on the commercial product. Now, the warnings section is one of the longer sections in the drug facts information. That's partially because it contains a lot of different subheadings. So, for example, if you look on the labeling here in the middle, the bottom of the middle, the warning section there you can kind of clearly see it says there's a do not use section, ask a doctor before use if you have section, then a ask a doctor or pharmacist before you use section, and then lastly, when using this product. So, and there can be additional sections in there as well, such as allergy, if you look on the one above. So, lots of different subsections of information. We do not need to cover and just say read everything on the warning section. What we want you to do is to prioritize this. Use your knowledge as a pharmacist to tell them any common side effects that could occur that they should be aware of, and then pick at least just one precaution or warning statement. And oftentimes there's more than one, but at least one thing that is important that they understand and that you can point out in this section. So, for example, if we look at the warning section on the drug packaging on the far left, this comes from a box of Nix cream rinse, which is used to remove lice. So in this section we could say, well, if you notice here, this medication does have a warning section with a lot of important information that you should refer to. I guess the things that I would emphasize with you, that if you notice here under the when using this product section, it does mention that scalp itching and redness are side effects that occur while using this medication. More importantly, some other warnings that it has is to be sure and keep your eyes tightly closed and protect your eyes with a washcloth or towel while using this medication. If any product gets into the eyes, you're going to want to immediately flush them with large amounts of water. So definitely keep this medication out of your eyes. That's all I feel that for us that you would have to verbally counsel the patient on. So in this section, we're trying to show them the warning section and let them know there is very important information in this section. And that what I would like to point out to you in this section includes the side effects, and here is a warning or a precaution statement I would share with you. All right, so let's go to the packaging on the top middle section, if you will, and this was for some Pepto-Bismol analgesic and for stomach and for headaches and things that they'll use. So in this medication, I would say, now as you can see, there is a warning section here with a lot of important information that you should definitely look through. I guess what I would point out to you here is that under this, when using this product, be aware that a temporary but harmless darkening of the stool or your tongue may occur. This drug can cause some darkening and color discoloration. It doesn't cause any harm and it goes away, but it can be disconcerting, so it's just something to be aware of. Also, I'd point out to you that this medication does contain salicylate, and we certainly would not want to take this medicine if you have an allergy to salicylates, and that could include aspirin, anything that has a salicylate in it. All right, so I went to the when using this product section and gave them some side effects, and then I gave them the warning about the allergy. The one on the very bottom here, labeling, is for diphenhydramine or Benadryl. So as you can see here, there is a warning section with some very important information that you should definitely take some time to look through. I guess what I would point out to you here is where it says when using this product, be aware that this medication can cause some significant drowsiness. You are very likely to become sleepy while taking this medication. And to that, but while you're on this, you're going to want to avoid things that can also make you sleepy. That can include alcoholic drinks or other sedatives or tranquilizers. Definitely can enhance this drowsiness effect. So you're certainly going to want to be careful before driving a car or doing anything that requires mental alertness until you know how this medication is going to affect you. All right. Hopefully I just gave you a couple of examples where you're going to point out the warning section so that they know there's important information in this section that they should refer to, but then take the time to go ahead and highlight for them possible side effects and then some important precaution statements that you as the pharmacist feel is important for them to know about. The next section to discuss is the N in NUDAWNS. So not the first N, but the second to the last letter, the N in DAWNS, stands for non-pharmacologic or non-drug treatments or measures or things to do. So this really refers to the fact that whatever condition the patient is using this non-prescription medicine to treat, there are also usually non-drug things that can be done to help also manage the symptoms or to treat the condition. So not instead of the medication, but in addition to the medication, some things that you can do to help manage your cough or to help with your constipation, with the example shown on this slide. So make sure you understand that. N stands for non-pharmacologic or non-drug things to do to help manage. So a transition might be, so in addition to taking this medication, some things that you can do to also help treat your constipation would be to increase your dietary fiber on a daily basis. Maybe also avoid some foods that we know can lead towards more constipation, which could include processed cheese products. It's important with constipation to drink plenty of fluid. So this could be 6 to 8 glasses, and these are like larger 8-ounce glasses per day of water. This can help soften the stools. And again, I don't want to keep reading all the information on here, but the idea here is, in addition to this medication, some other things you can do to help assist treating or managing your condition include And I would argue this section is the most difficult because this is not found on the drug facts labeling for most products. Most products just give you information about that drug product. They're not going to give you additional information about how to treat the condition. So this is why you learn this information as a part of pharmacy school. So the information shown on this slide, to give you some examples of non-pharmacologic treatments to recommend for certain conditions, come from the American Pharmaceutical Association, or APHA's, Handbook of Non-Prescription Medications. So this is information that would have been taught in your over-the-counter or non-prescription medication class. This is information a pharmacist needs to know to help a patient manage their condition, not just take a medication for that condition. So my last example here might be the gastroesophageal reflux disease, or GERD, on the lower right. Again, this coming from the APHA non-prescription handbook. You can see that there are certain things that can be done in addition to their medication. So you can say, in addition to taking this medication to help reduce the stomach acid, things you can do to help reduce the episodes of GERD that you might be experiencing would be to avoid foods and beverages and activities that make it worse. So again, if it's spicy food or Mexican food, tacos, whatever it is that you've had an experience of after eating causes you to have this acid reflux, we're going to want to try to minimize how often you eat or consume those foods. Also avoid eating those meals a large amount. So the smaller amount of food that you eat at a time can help reduce this. Also, certainly smoking, we know, is associated with increased episodes of GERD. Losing weight, reducing your dietary fat can be also helpful. So, and again, I don't want to just keep belaboring all of the points in the specific examples, but for whatever condition that you're going to be counseling on, there's often things that can be done in addition to the medication that you're recommending. And this is the section where you would provide that additional information. Well, we've reached the last letter in our acronym NUDAWNS, and the last letter in NUDAWNS is an S, and S stands for seek. It means, when should the patient seek further medical attention from a healthcare provider? Meaning, at what point should they give up on using the over-the-counter medicine by itself and seek additional attention? And this would occur under two situations. It would occur in general when the symptoms and things that they're trying to treat have gotten worse instead of gotten better, or they've continued to not improve over a certain amount of time. If they've not responded to the drug or simply have gotten better on their own after a certain length of time, then they should give up on this product and go to a healthcare provider to find an additional or a new way of treating it. So two general things. Either the condition gets worse or it doesn't get better in a certain amount of time. And just let's use some examples on this page to kind of show you that. So the one on the top here comes from the product Delsum, which is a cough suppressant, tries to help manage a cough. And here it says that, however, if the cough lasts more than 7 days, or the cough comes back and occurs with a fever, a rash, or a headache, this could be the sign of a more serious condition, and you should stop and ask your healthcare provider. Again, if it lasts for more than 7 days, or if it gets worse during this time, seek your doctor. All right, going down, so some allergy eye drops. In this case, it says stop use and ask your doctor if you feel eye pain, or you have changes in your vision, or you have redness and irritation. Would you agree these 3 bullet points are all things saying things are getting worse or things are bad? If they are, then you're going to want to stop. Or if none of that happens, but the condition doesn't get any better or lasts more than 72 hours, then again, it's been enough time that this product may not be helping you and may be due to something else. Okay? So, examples of things getting worse or things not improving within a certain amount of time. And I should emphasize here, and I chose these examples here because how long it should take before they would need to see their doctor is different for every product and condition being used. So again, the Delsum on top was 7 days, the eye drops in the middle were 72 hours. Again, and in the bottom right for the GI medicine, you can see it's 14 days. So how long before they need to seek their doctor will be different based off of the condition they're treating and the specific medication. All right? And I won't keep belaboring these points. You can see in these examples, though, in each of these examples, there are some bullet point or examples of how a patient would know the condition is getting worse or that they're not responding to the product, and a time at which, after this time, they need to stop and seek advice from a healthcare provider. I want to end this presentation by summarizing the NUDAWNS counseling format and then giving you a specific example to listen to from beginning to end. So to summarize, NUDAWNS, N-U-D-A-W-N-S, is an organized format in which to convey important counseling information to a patient about a non-prescription or an over-the-counter medication. It's an acronym that stands for N for name, U for the use, D for dosage, A for administration, W for the warning section, N for non-pharmacologic or non-drug treatments, and S when to seek medical attention. If you can remember the NUDAWNS, then hopefully you can remember the topics and the organization that can effectively help counsel a patient on this product. So let me end by having you listen to this format used while counseling a patient on the product Imodium AD antidiarrheal caplets.
The name of the product I am recommending for you is Imodium AD 2 mg caplets. This medicine is used for the temporary relief of diarrhea. Begin by taking 2 caplets by mouth after the first loose stool, then take 1 caplet after each subsequent loose stool. Do not take more than 4 caplets in 24 hours. Take this medicine by mouth with a full glass of water and continue to drink plenty of clear fluids to help prevent dehydration caused by diarrhea. As you can see, there is a warning section here on the box. I would point out that some common side effects include dizziness and drowsiness. Also, do not take this medicine if you have a bloody or black stool. Besides taking this medication, some additional things you can do to help include drinking plenty of water or rehydration solutions such as Gatorade, limit eating fatty or spicy foods, limit caffeine, and finally avoid following the brat diet due to it providing insufficient calories. If your diarrhea symptoms get worse or do not improve after 2 days, contact your primary care provider.